Health and Human Services Committee. I appreciate the opportunity today. I am State Senator Troy Jackson, and I represent Senate District 35 in Northern Aroostook County. I also serve as Senate Majority Leader. I am the prime sponsor of LD 1640 and co-sponsor of LD 1578, presented by Speaker Eves. These bills will secure $263 million from the federal government to expand Medicaid coverage to 69,500 hardworking, deserving Mainers, including veterans. Right now, these Mainers face a future without health insurance and without adequate access to necessary healing and life-saving medical care. I want to remind this committee and all of my colleagues in both parties, in the House and Senate, that these bills represent our last chance to do right by Maine people and families who depend on our actions. If Governor LePage had not vetoed LD 1066 last year, or if the legislature had stood up and overridden that veto, we would already be moving toward the goal of a unified, fair, and open health care system for all Mainers, regardless of income. Making public policy relies on both common sense treatment of facts and figures and on political philosophies. We know the governor's philosophy. He called this effort to expand health care in Maine, and I quote from his veto message, a massive increase in welfare expansion. But let me be clear, health care is not welfare. Not to me, and not to the single 69,500 Mainers who will be left out in the cold if we do nothing to bring them into our health care system. No, health care is not welfare. Health care is a basic necessity of life, like food and shelter and fuel. I believe health care is a basic right of everyone. But I'm not here to debate philosophy. I'm here to push for action, because time is running out to extend help to 69,500 Mainers who desperately need our leadership. If we do not expand Medicaid in Maine, we'll be failing as leaders. That failure will be wrong-headed and hard-hearted. It would be a heartbreaking tragedy for thousands of working Mainers and their families. Yes, working Mainers. The majority of people who wait to learn that they will have health care coverage do work. 65% of Maine's uninsured live in a family where someone works full-time. And I want to emphasize that, full-time. Full-time in retail jobs, food service and restaurant jobs, full-time in hospitality industry, full-time in office jobs, in manufacturing, construction, and transportation. They work full-time on the waterfront, in our farms and our forests. You and I, we know them all. They're our friends and they're our family members. The next time you pay a bill at your local diner or a fancy restaurant, look your waiter in the eye and know this, that that person is probably relying on you to offer help with health care. Next time you go through the grocery line and tell the cashier to have a nice day, that person is probably waiting to be covered by Maine Care. And the next time you go to a local farmer's market and buy local, that farmer and his workers are waiting for your decision to include them, not exclude them, from Maine's health care system. And their children and loved ones are waiting also. I'd refer you to reports and analysis compiled by the Maine Center for Economic Policy for a clear-sighted view. And I will highlight some of the findings that we must consider and weigh in order to make common sense public policy. And it is pure common sense to take opportunity we have right now and accept federal funds to expand Medicaid in Maine, to help those working Mainers who find themselves locked out of access to health insurance, and to take the next step toward a unified, fair health care system to open to all Mainers. What is that opportunity? Well, first, it's accept $263 million of federal funding in order to close the coverage gap and ensure Mainers who could go uninsured if we do not say yes to the federal government's offer. That money will allow us to potentially cut in half the number of uninsured Mainers. So if you earn less than $15,856 on your own as an individual, or if you are the breadwinner of a family of 3 earning less than $26,951, you will be eligible for Medicaid in Maine. You will gain access to a basic right. Second, let's understand the reality of our state and act so we can both expand Medicaid coverage and provide a measure of fairness to rural Mainers. Many working Mainers who may lose coverage and go without live in our most rural counties. If we do not expand Medicaid, we will penalize rural Mainers and undermine efforts to revive Maine's rural economy. If we do not expand Medicaid, we will divide Maine yet again and increase the gap between haves and have-nots, between rich and poor, south and north, urban and rural. The loss of basic health insurance would be crushing to individual families living in rural Maine, to businesses in rural Maine, and to the very healthcare system designed to provide medical care. I believe we have to open our eyes to this reality. Let's always keep in mind that our neighbors, friends, and family members are those who are relying on us. These working Mainers are not statistics. They are individuals with a common need, health care coverage and medical care. But facts and figures do guide us to understanding what is best if we just say yes to Medicaid expansion. For example, in Washington County, more than 13% of people from age 18 to 64 will become eligible for Medicaid. And Washington County could receive more than $9 million to fund that expansion. In Somerset, 11% of the people will become eligible, and the county receives more than $12 million. In Waldo, almost 11% get covered, and the county gets almost $10 million to help. In Androscoggin, 8.6% of the people and $20 million to help. In Penobscot, 8.3 and $31 million. And in Aroostook, 10.6% of the people get covered, and then $16 million for the county. The money available from the federal government goes into our state economy, creating jobs and generating state and local taxes. The money not only helps people in need, the money helps to expand Maine's whole healthcare economy. In Penobscot, Androscoggin, Aroostook, and Washington counties, as many as 1 in 5 jobs are in the healthcare related businesses and services. Many of these jobs are held by women whose families rely on their earning power. According to the National Women's Law Center, Medicaid supported jobs held by women in Maine amount to more than 17,000. And this number will increase when we say yes to Medicaid expansion in Maine. Third, the federal government funds that we accept to expand Medicaid bring health care and healthy benefits to working Mainers into our economy. I've talked about the direct economic benefits from our decision to expand Medicaid, and there is a benefit that matters most to working people, and that is more days on the job, earning a wage, making ends meet, and fewer days off the job because they can't afford medical care or receive ongoing care for chronic conditions or injuries. At a time when unemployment in rural Maine is chronically high, when low-wage jobs offer little help of economic security, with the minimum wage stuck in low gear, failure to expand Medicaid in Maine will add another strain on the budgets of working families. Failure to expand Medicaid will unfairly penalize rural Mainers and women who work in Medicaid-supported health care jobs. Failure to expand Medicaid will force Maine families to make terrible choices between basic necessities, food or fuel, shelter or medical treatment, a warm winter coat, or a drug prescription. To me, all this makes our choice clear. Just say yes to Medicaid expansion in Maine. Fourth, there are 2,700 veterans in Maine who will become eligible for care when we expand Medicaid. We shouldn't assume that all veterans, young and old, automatically receive care through the Veterans Administration. If we do not expand Medicaid, veterans will lose out and perhaps live out their days without a basic right they fought for, and that's the right to health care. Finally, let me say a word about Medicaid. There's little or no administrative fat to cut in Medicaid. 96% of Medicaid spending goes to pay for health care and long-term care for Maine people, not for administrative overhead. Medicaid works to help control costs for all of us. A failure to expand this program here in Maine will mean that older people, working people, low-income children, individuals with disabilities, and even returning veterans will have nowhere to turn but to the emergency room. Or worse, they'll put off care and suffer pain and ill health silently, without complaint. Now I gotta ask you, is that right? Especially when every lawmaker in this room and in that building has access to government-funded health care. Will we ask working Mainers to take a dose of Yankee Stoicism because we don't use common sense and offer a little Yankee practicality? That's what it comes down to. Accepting the federal government's offer to help use $263 million to cut in half the number of uninsured Mainers, use this money to bolster our state economy and to provide a basic right. Act now because 69,500 Mainers, people we know, people who live down the road or around the corner, whose children go to school with our children, the ones who sit in the pew every Sunday in church with us, and who work with us, who are a living, breathing, vital part of our community. Act now because these Mainers are relying on our leadership. I'd just like to say that, I put this bill in as a concept draft because I believe in Speaker Eves' bill that we had, or the basic premise of what we had last session, which was a compromise between members of the Senate. But the concept draft is that I am very open to having more debate and more discussion on this bill. I have a number of people that are trying to get information of what other states are doing with managed care and things like that. I'd hopefully be able to present at the work session next week. But I have to say that I included in my testimony that I'm a Democratic majority leader, and I'm very proud to be that, but I care not about what the parties say about this issue. For me, this is something that I believe in very much. It's something that, I'm running down to the end of my time here in this building, and I don't really know where I'm going to be in the future, but I know that when I got started running for the legislature, this issue more than anything drove me. I know people very well that go to bed at night wondering what's going to happen to their family if the pain in their chest becomes more than just a pulled muscle, or the issues that could come up for them that they don't have health care is something that I don't believe people should actually have to worry about. And I think this is something that we should take advantage of, because I do believe that people deserve the right to health care in this country. And this is an opportunity to at least cover some people. We have challenges, but I honestly believe that we should do everything we can to make this happen. I think I heard the early discussion about the lady that Speaker Eves talked about with the diabetes, and people asked if questions or whatever. Well, these people, they could be any one of us. To be perfectly honest, it could be me in a year. The log profession, I believe the average earnings is $27,500. So a lot of the people in my field is going to be on that line, and I would ask anyone if you think that men and women in the log profession don't work for a living. I think they would or most people would say that they work very hard, but it is a occupation that for a lot of people doesn't pay a high wage. And because of a lot of the arguments that I've made in the past, very few companies provide health insurance in the logging field. So, I never had health insurance until I became a legislator. So I might be one of the people that you're talking about here in a year or so. But these people that we are talking about are everyday common people. They're not the slackers or anything like that. They're out there working, and that's why they don't get any health care coverage. So I am very much in favor of doing something to help them. And I would like to see this committee try and take this bill up and make something out of it. So with that, I'll take any questions, and I appreciate your time here today.